my name is Dr. Oladeinde, and I'm a program officer at the National Institute on Minority Health and Health Disparities. And today I'll be talking about the NIMHD Research Framework for the Patients Professor Academy. The framework was developed in 2015, and this was developed as part of the NIMHD Science Visioning process. It was really intended to be a vehicle to convey NIMHD's philosophy and priorities for minority health and health disparities research. The framework was derived from the socio-ecological model and the NIA, the National Institute of Aging Research Framework. The framework addresses the limitation of conducting research that only looks at the effects of a single determinant of health disparity. And so it highlights the need for addressing both the biological and the social determinants of health. The framework does communicate that conducting research entirely within just one level of influence or one domain of influence, for example, just at the individual or the biological level, which is what many traditional health research does, oftentimes does not give us the full picture of what is really happening as far as disparities are concerned. And so it looks at the life course perspective. So it emphasizes the life course perspective of considering factors ranging across the lifespan in determining health disparities. So consideration is given for early adverse events all the way to older adulthood to fully understand the determinants of health across the different domains and the levels of influence. The framework can be downloaded through this link, and the link is found on the NIMHD website. So to give an overview of what the framework looks like, the framework is a multi-dimensional model, and it highlights the multiple determinants of minority health and health disparities. Each determinant may highlight the root cause of the disparity or the point of entry for the intervention. So on this matrix, that's the framework, on the y-axis, it depicts the domains of influence on health, and the x-axis depicts the level of influence on health. The framework consists of 4 levels, and those 4 levels of influence are the individual, interpersonal, community, and societal levels, and the 5 domains of influence, and the 5 domains are the biological, behavioral, physical environment, sociocultural environment, and the healthcare system. It's important to note that when the different cells within the framework are crossed, it generates 20 cells, and that's by crossing the levels of influence and the domains of influence. Each cell reflects the determinants that may be relevant for any minority health outcome or health disparity. And there may be some conceptual overlap between the cells, and that's okay. For example, at the societal level, there may be policies and laws that may be contributing to the health outcome that we see. And also, this may fall within the behavioral domain. And that's fine if there's some overlap between the cells. It's also important to note that the determinants in any cell may have a positive or negative impact on minority health and health disparities. So this is what a graphic that shows what the framework looks like. And here on the x-axis, you can see the levels of influence, and on the y-axis, you can see the different domains of influence. So how is the framework to be used? You know, the possibilities are endless on how you can use the framework. There are many different ways the framework can be used, and we'll see later in the presentation when I share some examples of how researchers have used the framework in the past. The framework can be used as a tool for organizing your research ideas. It can be used to guide your data collection, your data analysis, and also interpretation of qualitative data generated. The framework has also been used as an organizing tool to categorize the different themes generated from qualitative data into the different domains and levels of influence. The main takeaway is that the framework is to be used in planning and depicting the different determinants of health that would serve as facilitators or barriers for improving minority health and health disparities. The framework can also be used to assess the state of current research, to identify gaps and opportunities for future research. Investigators conducting research on minority health and health disparities are encouraged to use the framework as part of their work. And also, those researchers that are supported by NIH are encouraged to consider using the framework. So who's the target audience for this framework? Honestly, it's for everyone. In particular, for researchers conducting research on minority health and health disparities, and also for those that are supported by NIH, they're encouraged to consider using the framework. Also, educators can teach about the framework in their courses. They can use this framework in their presentations, in the manuscripts that they prepare, and the framework can be used either in its original form or it can be adapted to apply to a particular research question or population. Community-based organizations can also use the framework. And honestly, the framework is for anyone looking to examine health disparities using a multi-domain and multi-level approach. So I'm going to present some examples of ways that researchers have adapted the framework for use in their research work. The first example is by Manson and colleagues from the University of Colorado. And Manson and colleagues adapted the framework to emphasize the determinants that are salient for the American Indian and Alaska Native populations. And the reason why they found this framework very useful was because many of the conventional research frameworks that are out there, they don't really consider or they reside outside of the normal experience of non-native groups. And so when Manson and colleagues use this framework, they use it to examine the determinants that are relevant to understanding the health and well-being of American Indian and Alaska Native populations. And so they focused only on two domains of influence, the sociocultural environmental domain, and also the healthcare system domain of influence across all levels of influence. The other example is Pravidi and Vega. Pravidi and Vega from the University of Puerto Rico used the framework to address how Puerto Rico's living conditions, historic and sociocultural influence contributes to adverse health outcomes at all levels of influence. And for this, Pravidi and Vega, they actually used the framework in its original form. The final example is from Haito Widman and Budwani's work. And what they did, which is quite unique, is that they combined the NIMHD framework and the World Health Organization Strategic Advisory Group of Experts model. So they combined two different models to address vaccine hesitancy in the Southern United States and also to guide intervention development. So they did combine two different frameworks and they used specific aspects of the NIMHD framework in their work. So what does all of this mean for the future of health disparities research? The framework allows for a comprehensive assessment of the multiple determinants of health, their interactions across the life course, and how that can be tailored, how that can be used to tailor interventions to populations that experience health disparities. So with the framework, we're better able to tailor interventions to unique populations that experience health disparities by comprehensively assessing the multiple determinants of health across the life course. Another way the framework contributes to the future of health disparities research is that it provides an avenue to address the intersectionality across and between the different domains and levels of influence to achieve health equity and also to reduce health disparities. These are some of the references used for the work. The first one is the NIMHD Science Visioning, which I'll encourage you all to take a look at. And the second one is a manuscript that was developed based on the NIMHD Research Framework. And these are some of the ways that you can contact us. You can visit us online. You can also connect with us through Facebook and also follow NIMHD on Twitter. Thank you very much.